when we're closing services as basic as the emergency department, the one place that you expect to be open 24 hours a day to access healthcare, that's actually a profound problem.
6-7 hour waits to be seen in urban emergency departments, or paramedics are waiting for hours and hours to offload their patients.
Many of us would argue that it's beyond a crisis at this point in time.
I'm from, Eastern Ontario, originally near Ottawa, and my wife and I were looking for a place to practice that would have good lifestyle, interesting practice, good colleagues to work with, and Wawa had all that, so we decided to stay here rather than move closer to home. And I think that one of the advantages of being in a small northern town as a family doctor is you really get a huge scope of practice. You have to do medical things that you wouldn't be called on to do in more urban or settled places. So that was great. But as our cadre or group of colleagues gets smaller, it's hard to really offer that to new people. It's not a selling point if you're one doctor looking for a place to live and work and you're looking at a place that's short 10 doctors, not that Wawa is, but that's not that appealing. So the issue here, like Wawa has been fortunate over the past probably at least 30 years, or most of it 30 years anyway, to have a great complement of physicians and provided pretty seamless services to the community in terms of inpatient care, family practice clinics, emergency room services. Previously there was surgery and anesthesia, obstetrics. Gradually that has been whittled down. Like the older docs who did some of those subspecialty things have retired and we haven't been able to replace them. And other communities have been faced with that sooner than we have. Certainly I know Blind River, Thessalon, Red Lake has been a problem, Chapleau may have had a problem, and it's not just confined to Northern Ontario at all. Other towns and cities in, across Canada have really been confronted with similar problems. I mean, in some places you might have access to another urban emergency department within a 10, 15, 20-minute drive, but in Wawa it's 2.5 hours to get to Sault Ste. Marie, so it's not safe in the case of true emergencies.
For us in Marathon, Wawa is our nearest hospital to the east, and it's 2 hours away. Terrace Bay is our nearest hospital to the west, and it's an hour away and significantly smaller. So if an emerge department in a place like Marathon has to close, then people are driving a significant distance. And we know from studies elsewhere that, for example, if you're having a heart attack, your risk of dying increases by 1% for every 10 minutes that you have to travel to another place. So having to travel for an hour, often more on bad winter roads, really puts people's lives at risk. And I think we all have had experiences, Wawa has had experiences, we've had experiences here with significant motor vehicle accidents where everyone who works in healthcare has come into the hospital to take care of those 6 or 10 or 12 people who've been injured. And to think about what would happen if the emergency department was closed at that time, the reality is that lives would be lost. It's a significant burden to bear if you feel like the emerge department might have to close because you personally couldn't do one more shift. And that's painful.
Like I said, some of my colleagues are describing it more as an emergency. We have thousands of patients that are orphaned, have no access to primary care. We have emergency departments across Northern Ontario that are closing. They do not have physicians or nurses to support them. And so our small rural communities are suffering the most, but even large communities across Northern Ontario like Sudbury, Sault Ste. Marie, Timmins, North Bay are struggling to keep family physicians who we currently have and to create more so that we are able to reduce the orphan patient population across Northern Ontario.
Part of my worry for the North is that currently 415,000 people in the GTA don't have a family doctor. And historically, physician shortages have really been an issue for Northern Ontario and pockets of rural Southern Ontario. We have not ever seen this kind of gap in the ability to access family physicians in a place like Toronto or Ottawa or Kingston. And I worry a bit for what that means for Northern Ontario, that the historical challenges that we've had may increase because of the broad demand all across the province now, and that's new.
Provincial governments didn't adequately plan for the number of family physicians that were going to be needed starting in the 1990s, and they reduced spots in family practice residencies. I mean, since then they've increased them, but that's going to take quite a while to catch up. And the flip side of that is probably over the last 10 years, family practice has become less attractive to graduating medical students. They've, for a number of reasons, seem to prefer to go into specialties, so it's been harder to fill those residency positions. Less family physicians have been produced. What we're faced with now is not being able to fill our complement of physicians. Before, we may have had 5 or 6 full-time doctors living in town, and now we have 4, soon to be 3. So to do all the things that we're expected to do, run a practice, look after inpatients, and staff the emergency department 24/7, it's going to be difficult, if not impossible.
I do think that we're in a crisis in healthcare. I don't think it's an unsolvable crisis, but when we look at those emergency department closures, very basic service, when we look at the fact that currently in Ontario, 1 in 5 people doesn't have a family doctor, I don't remember it ever being that way. People have generally been able to access primary care. And so that unprecedented level of challenge to access of care, to me really does signal that we are in a crisis and we have a lot of work to do to get out of it. Again, it's not unsolvable, but it is a significant challenge.
Yeah, it's clear that we're in a crisis as far as lack of family physicians in small towns, and people could help by talking to their MPP and possibly even their MPs and just reinforcing that this is an issue. They're concerned about lack of services or potential lack of services, even contacting the health minister to say, this is a problem that's bothering our community.
This is a really complex issue, and it is not going to be solved by 1 or 2 simple solutions. So, part of it is the training and education pathway. That's why NOSM University exists. And so part of what we need to do is be training physicians so that they're prepared and equipped to be excellent clinicians for Northern Ontario, because all Northern Ontarians deserve not just some care, but excellent care, and care that would be equitable to people living in other places in the province. So we need a training pathway that produces physicians who will provide excellent care in Northern Ontario. We need then to be able to recruit physicians to our communities, and you may have heard about faster access to licenses for physicians who've trained abroad. And that's one strategy for bringing more physicians into Northern Ontario. And that will be really helpful as long as we create communities that are welcoming for those physicians, that they are also supported with culturally appropriate resources, that their families are supported, that we're welcoming them well to our communities. And if we can do that, and support them with mentorship, support in the emergency department, access to ongoing education to meet their ongoing education needs, then we may be able to retain them. And if we can retain them, then that's a win for the community, because we know when physicians work in continuity of relationship with patients, that outcomes are better, patients are more satisfied, and costs across the system are decreased. And so we need to move away from the revolving door approach that we have sometimes had of, bringing in people for a weekend here, a weekend there, and being quite locum dependent. We've kept services open doing that, but we haven't necessarily delivered the kind of care that the population wants, which is care from physicians that they come to know, and those physicians come to know the community. So it's going to take a lot of strategies from a lot of different approaches, but if we can come together around that, then I do think that we can solve our healthcare crisis. It's not going to be a quick fix, but over the next 3 to 5 years, we can put lots of these strategies in place that will make a difference for our communities.